Hello everyone and welcome back to MedSynapse in collaboration with NCSM, the trusted space where science meets support and clinical insights meet community action. I'm your host Hetvisha, and today we are diving into a critical yet often overlooked aspect of cancer care, which is dietetic support. From treatment tolerance to recovery and quality of life, food plays a far more powerful role than we often give it credit for. And guiding us through this essential conversation is someone who lives and breathes this purpose, Mrs. Nurussyahamah Taqiah Binti Nurunnajmi, a dedicated dietitian with a deep passion for oncology nutrition. With her experience supporting cancer patients through tailored dietary strategies, she's been at the forefront of improving outcomes through personalized medical nutrition therapy. So, welcome, Mrs. Yama, and we're truly honored to have you with us today.
Thank you.
Yeah. So, let's start right at the core of it. So, why is dietetic support crucial in cancer care, and how does it impact treatment outcomes?
All right. Basically, hi. So answering to the question why dietetic support is crucial in cancer care. First thing, when we are talking about food, okay,
Mhm.
and nutrition, okay, actually, if we have a proper nutrition, okay, it can help to maintain our body weight, not increase, not reduce. So same goes to cancer patient. Okay, first is to maintain their body weight, preserve their muscle mass, which is also an issue when they are doing treatment. And it's common for us to see their muscle mass is declining, and also to support their immune function, which overall can improve the treatment tolerance and also recovery. Okay, so talking about proper nutrition itself. So when the patient itself has a bad nutrition, I mean poor nutrition, okay, uh, it can lead to the risk of malnourished or even malnourished itself. So when these malnourish happens, like I said just now, it is linked to poor treatment outcomes, poor treatment response, increase their hospital stays, which can also affect their emotions, and reduce quality of life. As example, become weak, not able to walk, not able to talk, not able to eat, not able to socialize even with family, the nearest family. So that is why dietitian's role is very, very important to provide dietary support through what kind of assistance? It is through the personalized one-to-one consultation, individualized consultation. So we will give dietary plans for them according to their current condition to manage side effects of the treatment itself. As example, nausea, loss of appetite, taste changes, to prevent the malnutrition itself and enhance their energy levels, so that they can go through the treatment of cancer until the end, at least before we provide how to maintain their nutrition for recovery and all.
Yeah, I think nutrition is actually synergy that truly empowers healing also. So it actually plays a
Yes.
crucial role.
Yes,
Uh,
very crucial.
yeah. So now in Malaysia specifically, how do community dietitians collaborate with healthcare providers to support the nutritional needs of cancer patients?
All right. So when talking about collaborating with other healthcare professional, right? So actually here we have a lot of NGOs lah. But basically I'm talking about on behalf of National Cancer Society Malaysia, what I am doing as a community dietitian. Here in our center, we have a referral system whereby any doctors or any oncologists or nurses or any social workers that work together with patient can refer any patients that they find at risk of malnourished, including for those who just have maybe basic questions about food and nutrition before they start their own treatment lah. right? So when they refer to us, then um, it's my job as a community dietitian to provide education on how to, as example, eat properly lah, basically. And then in and National Cancer Society Malaysia as well, uh, we cooperate with hospital to uh, refer to us the patients that need transition from hospitals to home care. All right. So whenever the patient has finished the treatment, as example, so they need to go home and the patient is in tube feeding. Okay. So or non-tube feeding cases as well. So basically they need extra support from us as community dietitian, which clinical dietitian doesn't cover at their hometown. So we will cover that lah. So basically it's a one-to-one um collaboration lah basically. But despite of many efforts, many patients still come to us with deep rooted misconceptions about food. That is why community dietitian exists lah.
Okay,
Yeah.
that's very true. And actually, that brings me to the next question about misconceptions only. Like
Okay.
that comes with every day, but is
Mm.
equally important. So, what are some of the most common nutrition-related misconceptions you
Mhm.
encounter among Malaysian cancer patients, and how do you go about addressing them, especially?
Okay, misconceptions. There are a lot of
True.
misconceptions. Yeah,
Especially
among
when
patients.
diet is concerned.
Yeah, okay. Now I am talking about those patients who haven't started any treatment yet, but they have so many information that come in from relatives, family, and close friends. But no. All right. So basically, among common misconceptions, first is they said sugar feeds cancer. So they start to omit uh, carbohydrate, no matter what types of carbs, complex, simple. They restrict it 100% until it leads to malnutrition itself. Like they have inadequate intake. Like the most common symptoms that I can see once they have restricted food intake is that they become so weak. Mm.
Mm.
And then the second thing is eggs, conventional chicken or seafood or even plant-based protein. They say can make cancer grow, right? So they basically avoiding all vital protein sources which are important for their cancer recovery. And then before start treatment itself also lah. Okay. And the third thing which is common is herbs supplement. Mm. Herb supplement they say can cure cancer. So according to Europe Society Parenteral Nutrition, Clinical Nutrition in Cancer, they don't recommend any herb supplementation to be used for patients to replace the food and all because it can link directly. They can interfere with the active treatment that they are doing. So that's why we don't recommend that lah. But how dietitians address them? Okay, so how dietitians address them is basically we need to use evidence-based education to counter myth instead of just giving fact this cannot, this can. There are no such thing exact things like yes you can eat, no you cannot eat. So basically there are ways to eat. Alright. And then second thing is we need to use culturally appropriate explanation. As example, besides of education, besides of evidence based, so we need to explain why protein is important. So I need to basically link with their symptoms and then give an comparison basically when they eat when the doesn't eat and such those things lah basically must link to their what they feel every day as well. And then lastly, I think collaborate with doctors as well and any other healthcare professionals to reinforce the nutrition message lah. Not work together with the other
Mm.
healthcare professionals lah, basically. But
True, true.
sometimes even patient understand what good to eat, how to eat, but um in terms of affording the food is itself can be the next challenging this is what I found when I am working as a community dietitian lah, basically.
Yeah,
It's a big
very
issue.
true. Hmm. I think addressing this issue is really necessary also and so important also. But
Mm.
then, when with the right knowledge, real world challenges persist. So, how do Malaysian dietitians like yourself handle the very real challenge of affordability and access to nutritious food for cancer patients?
All right, understood. So that's why, just I said before, individualized counseling is very important, one to one, right? So what we as dietitians suggest is based on the assessment that we do to the patients. Okay, so any interventions, any suggestions must be on their within their budget. Okay, so budget friendly meal plans is very, very important. Using local product that are available in Malaysia, not expensive foods. As example, in Malaysia, if okay, like as usual, we're talking about salmon, and all about omega 3. But what are the other options that can work as well with the same, even more quantities of omega in the fish, which is ikan kembung, and then any other protein options that can offer the same or even more nutrients than the one that we always heard lah, basically. And then besides that, besides working within their budget, um there was also nutrition assistance program actually, okay, through a few NGOs, and then government subsidies and hospital food support initiatives like in Malaysia. Okay, so this is very important because like I said before, if we're talking about food that is good to eat, there are so many unfortunate patients that can't even buy egg. Yes, I have found this lah. Egg or bread, not even bread, they can afford to buy. So I need to find like what are the most common food that they eat every day, and how can I adjust them for them to at least get the nutrients to maintain or support their basic body working lah, basically. So that's why lah, community dietitians need to teach them on how to choose nutrient dense foods based on their budgets. Yeah, so that's the thing
Yeah,
lah.
true. I think that's a compassionate yet practical perspective of yours, Doctor.
Yes,
So
yes.
now, speaking of support, let's
Mm.
shift focus to the bigger picture. Like, are there any local community programs or initiatives that actually actively helps provide dietetic support to cancer patients in Malaysia?
All right. So local community initiatives, right? All right. One of it is we National Cancer Society Malaysia itself has a collaborate with one government hospital, but soon to be more and more. Okay, so we collaborate with a hospital Kuala Lumpur as for now. Um, to open a dietetic oncology support center, which is called DOSH. So here we provide outpatient dietetic care, one-to-one counseling with patients for those who are doing treatment at daycare, and also radiotherapy unit, daycare for chemotherapy and then radiotherapy unit for radiotherapy lah. So basically, here we can complement task of clinical dietitian who usually attending inpatients lah in ward. So that's how we do, because we want to focus more on outpatient as well, because at this stage the patients are on treatment itself. and then they start to develop the side effect already. So that's why dietetic care is very important already at that time, not until they get warded, then dietitians see no. So we are trying to provide care as yearly as possible lah. And then there also we also do home visit, like I said before. Okay, home visit to patients that are not able to come by reasons of financial, or by patients who has low capability to come because of their mobility. As example, on wheelchair, bedridden patients. So we also do home visit to the house and do counseling, not only with the patient but with the house, with the family, sorry. And then provide nutritional support lah, as example, milk for low income patients lah, basically. And then also mm, like the same pattern, home visit programs, but by the other pharmacy brand that I know as well lah. Okay. And then another local community initiatives, all right, to help provide nutrition support is that there are also many financial aid for medical nutrition support, because the nutrition support, as example, oral nutrition supplement, the milk, the powder, the formula milk is very, very expensive, right? So there are financial assistance for the patients outside, such as zakat, if in Malaysia, zakat, NGOs and hospital social welfare funds, etc. Also, that there are a lot lah actually that can help them to complement the other help lah, basically. Yeah.
Yeah, it's so interesting and heartening to know about these initiatives that actually exist in Malaysia. Really interesting. Mrs. Sharma, before we wrap up, I'd love for our listeners to hear something truly personal and inspiring. So, could you share a case or community initiative in Malaysia where nutritional support significantly transformed a cancer patient's journey?
All right. So, but is that okay if I share with you? Now the patient has been passed away, but it's a case that stayed in my heart lah, because the changes that he has
Mm.
that he has received so far lah. So this patient is an elderly, so he's diagnosed with lung cancer. And when he was referred to me, initially he was on oxygen. He was on oxygen tube. And then he had significant weight loss from almost 60 to 35 kg. I remember. Yes.
That's
Significant
such
weight
a
loss
significant loss.
at the initial diagnosis, early the diagnosis. Yes, directly stage 4 at that time. And then he also experienced loose appetite, altered taste, swallowing difficulty, swallow to breath. So basically, very, very poor quality of life at that time, with the emotions that has been down because of the diagnosis. So when the family reached to me, I do multiple home visit and give nutrition support, nutrition interventions until he take off the oxygen mask, and from he bedridden, from he was bedridden until he can walk slowly. Huh. Until he walks slowly, but just inside the house lah. And then the weight has also increased to last time I remember is until 47, 48 something. But unfortunately, after that he passed away lah. But what I want to highlight is that from anxiety that he has got, from the difficulty to swallow, and then gastritis because of not eating at all, and then from very, very weak, he has transformed to uh, a better person lah. I can say. because he has the energy and also strength to at least um live, and he is doing the treatment at that time, uh, even though only eating medications, but it affects him a lot lah. So that's why this case is very a bit touching to me, because I can see his journey for about 1 year, ups and downs, until he passed away lah. So basically, this is a journey that I witnessed, that touched my heart as a dietitian, and it's also teach me that it's not only a task between me and also the patient itself, but it also includes a variety team lah, with the doctor, and then with the nurses, with the caregiver of the patients. It's not easy to help the patients if the caregiver is not supportive. Okay. And then basically all those things lah. The oral nutrition supplement accessibility and all. So what can I conclude is that nutrition is is not a luxury, but it's a part of survival. Yeah. So that's the case lah that I can that's is one of the case that I can share.
Dude, that is such a powerful message that you share. It's very unfortunate that the patient passed away, but the
Yeah.
transformation was very interesting and
Yeah.
inspiring also. Like with the nutrition, a lot of things can happen. So that's
True.
really impactful story, the Mrs. Sharma.
Mm,
And as we wrap up today's session, a huge thank you for sharing your wisdom and passion with us today. And thank you so much for
welcome.
joining.
Thank you so much.
And to all our listeners, whether you're a healthcare provider, caregiver, or someone navigating cancer yourself, today's episode reminds us that healing is not just about medicine, it's about the nourishment. And do not forget to subscribe, share, and join us again for the next episode in our MedSynapse and NCSM series. So until then, take care, stay informed, and never underestimate the power of a well balanced plate.